Hello, thank you for watching. This is going to be a test presentation for Group 6. Our topic is Medicare. Okay, so a brief background about the issue. What is the issue? As American seniors grow older, their health condition deteriorates, meaning they are more susceptible to disease, illnesses, and injuries. Americans can also suffer from physical and psychological disabilities. These disabilities can impact them by hindering their ability to work, study, and perform daily activities. The main concern for American seniors and disabled citizens was the significant need to access health insurance coverage so that they can get help financing their medical needs and concerns. The federal government's resolution to this issue is to create the Medicare program. On July 30th, 1965, President Lyndon B. Johnson signed a bill that established Original Medicare Parts A and B. Medicare affected the American healthcare system because it provided government funding for medical expenses. Medicare made healthcare a universal right for all Americans aged 65 and older and qualified disabled citizens. Medicare has overall improved the health and longevity of their beneficiaries. Okay, so a brief background about Medicare. Medicare is basically a government-sponsored program that provides healthcare coverage for American seniors. Those seniors have to be age 65 or older, disabled American citizens that qualify for Medicare, as well as people that are diagnosed with end-stage renal disease or Lou Gehrig's disease. A senior might be subjected to a late enrollment penalty if they enroll later than his or her 65th birthday, and they will be responsible for any late enrollment penalties that incur after being enrolled past the 65th birthday. There are four essential parts of Medicare: Medicare Part A, Part B, Part C, and Part D. Generally, Medicare helps pay 80% of medical expenses, and the 20% is paid by the beneficiary. How does Medicare affect people at the individual level? Medicare is a government-sponsored program that helps pay for 80% of healthcare expenses for those who qualify, including American seniors age 65 or older, qualified disabled Americans, and people diagnosed with certain medical conditions like end-stage renal disease, which is a type of kidney disease, and Lou Gehrig's disease. There are many services covered by Medicare, including long-term care or custodial care. There are many services not covered by Medicare, such as long-term care, most dental procedures and dental services such as dentures, foot care, acupuncture, hearing aids, and exams for fitting them, medical services, treatments, procedures, and care outside of the USA, cosmetic surgery, massage therapy, routine physical exams, and concierge care. And there are several enrollment periods, including the initial enrollment period, which occurs 3 months before the beneficiary's 65th birthday and 3 months after. So it's for a time span of 7 months. There's also the Medicare annual enrollment period from October 15th to December 7th. And the Medicare open enrollment period from January 1st to March 31st. In the Medicare special enrollment period, to qualify for the Medicare special enrollment period, you need to have certain qualifying events. These events include having a baby or adopting a child, getting divorced, death with a family member, moving or changing locations, or losing your health insurance coverage, and other extenuating circumstances. Medicare Part A. So who's eligible for Medicare Part A? Medicare Part A is also known as hospital insurance. People who are eligible for Medicare Part A are American seniors age 65 or older, Social Security or Railroad retirement beneficiaries, disabled American citizens, Americans diagnosed with end-stage renal disease. Some of the Medicare Part A covered services include inpatient hospital services like rooms, meals, general nursing, drugs for treatment, skilled nursing facility services up to 100 days, home hospice care, and hospice care. How much does Medicare Part A cost? Well, Medicare Part A is premium free per month if individuals work for 40 quarters or more. However, if you have not worked for 40 quarters or more, it's up to $458 per month for the monthly premium for 2020. As for the late enrollment penalty, the monthly premium may go up to 10%, and they will have to pay the higher premium for twice the amount of years they could have had Medicare Part A but didn't sign up. Original Medicare is Medicare Part A and Part B. With Medicare Part A is hospital insurance, and Medicare Part B is also known as medical insurance. Who is eligible for Medicare Part B? Medicare Part B is available for American seniors age 65 or older, American citizens and residents, alien residents who have resided in the USA for 5 years prior to enrolling, qualified disabled American citizens, and Americans diagnosed with end-stage renal disease or Lou Gehrig's disease. Medicare Part B covered services include physician services, outpatient hospital services, laboratory services, x-rays, diagnostic testing, ambulance services, vaccinations, preventive services, and a lot of the services are listed under this slide. Medicare Part B premiums are different if the Medicare beneficiary is enrolled in Medicare Part B for the first time. The member doesn't receive any Social Security benefits. Members are directly billed for Part B premiums. Medicaid pays a partial or full amount of Medicare Part B premiums. And this is the late enrollment penalty calculator for Medicare Part B. Additionally, we have Medicare Part C, which is Medicare Advantage. Medicare Part Advantage or Medicare Part C basically covers all the benefits of Medicare Part A and Part B except hospice care. And these are what types of plan features are available for Medicare Part C. Medicare Part D. Medicare Part D is also known as prescription drug coverage. It helps pay for the cost of medications prescribed by a doctor. Enrollment in Medicare Part D is optional. A person can enroll in Medicare Part D if they are enrolled in Medicare Part A and or B. Furthermore, they have to live in the service area to qualify for a Medicare Part D prescription drug plan, PDP or MAPD. There is no enrollment penalty since enrollment is optional. And this is how you calculate the cost of a Medicare Part D plan. And these are the different types of prescription drug tiers. From the first is the least expensive to the fifth is the most expensive. So the most least expensive is preferred generic drugs, then generic preferred brand name drugs, non-preferred brand name drugs, and specialty drugs are the most expensive. And this is the 4 phases of Medicare Part D coverage. It tells you how much you would pay for each phase of Medicare Part D. Medicare Supplement. Medicare Supplement or Medigap plans, basically they cover the gaps that Medicare doesn't cover, such as co-payments, co-insurance, and deductibles. Medigap plans typically are more expensive than Medicare Advantage plans. You have to be enrolled in both Medicare Part A and B to qualify for a Medigap plan. And Medicare supplement insurance policies or Medicare Gap policies are sold by private insurance companies. And these are the different types of Medigap plans ranging from Part A to Part N. Well, thank you for watching. I hope you enjoyed this presentation.